Wanted to do a quick video about a new study. Just came out March 20th, 2024, depending on when you're looking at this, but we just made this, and it's about DHA, that it may be critical to the length and the quality of our health, of our lives. And let's just take a look at some of these, because it's really quite incredible. And this is the name of the study. It was put out by the Mayo Clinic. Circulating docosahexaenoic acid and risk of all-cause and cause-specific mortality. And you can see it says that the higher the DHA levels were associated with significant risk reduction in all-cause mortality. It just goes through. Let me just show you some of this information here. Let's see if we can move myself off of that. There we go. And as you see, this is a study released 3/20/2024, analyzed over 160 people for 14 years. What they found is they compared the people with the highest measurements of DHA with the people of the lowest. And they used over 8 versus under 3. And the best test for that is the omega-3 index test you can get. But what they found when they compared these groups was that the people, when the highest DHA levels of this was circulating DHA in the body, they had a lower risk of death. There was a 17% lower risk of death of all-cause mortality. There was 21% less risk of death for cardiovascular issues, 17% less risk of death for cancer issues, and 15% for other causes. And this was adjusted for various risk factors. And remember, really the best thing to do to get DHA is from good, healthy seafood, particularly wild seafood. And by the way, you want it as a food and not as a supplement, because of the fact that the supplement has the DHA, it's what's called the SN2 position. And that opposed to the seafood has an SN2 position versus the SN1 position. That helps maintain polarity of the DHA. And here's the thing. You have to realize DHA stores electrical potential. That's what it does. It's probably one of the most important nutrients of the entire body. The body cannot make it. It has to get it from an outside source. The best sources are seafood, and it really acts as a semiconductor. And that's really the big thing, that it's able to act as a semiconductor for the body's energy system. So it helps turn the electrons, the photons in sunshine. It converts that to DC electrical energy. And if you don't have enough of that, what has to happen is your body has to produce more ATP for its energy. And when you're producing more ATP, you're creating a lot more free radicals. And so you really want to be able to transform that sunshine to that DC electrical potential. Now, if you don't, there is some other things required. For instance, you do have to have iodine. But the thing you have to realize is this is part of it's really a semiconductor within the body. You have water, collagen, cholesterol that's not oxidized. It's very important for the brain. It allows that, but it has to be, you want it in that SN2 position. So I recommend eating, always making sure that you eat seafood 3 times per week is my minimum for my recommendation. But I just wanted to get this out real quickly. And let me just go to our disclaimer. The information provided is for educational purposes only and is not medical advice. Statements made are the opinions of the participants have not been evaluated by the Food and Drug Administration. By providing this information, we're not diagnosing, treating, curing, mitigating, or preventing any type of disease or medical condition. This is not intended as a substitute for professional advice of any kind. Before beginning any type of natural, integrative, or conventional treatment regimen, it's advisable to seek the advice of a licensed healthcare professional.